If you're dealing with neck pain or the associated headaches, you already know the discomfort can fluctuate from being merely bothersome to almost unbearable. You know, there are several different causes that lead to neck pain and those headaches. And with us now to talk much more about it, Christina Penny with GBMC, a physical therapist there. Christina, welcome aboard. Great to have you here.
Thank you for having me.
Great to have you. Look, it's an important topic. A lot of people out there suffering from that neck pain. Let's talk a little bit first about some of the causes and maybe then move towards some of the treatments.
Okay, so what we typically treat for in physical therapy is something called a class of cervicogenic headaches. And so with cervicogenic headaches, what we typically see is that people have stiffness in their muscles, they have tight muscle bands, limitations in range of motion, and tightness in their upper cervical spine.
Yeah.
And so with that, what we're looking at is differentiating treatment interventions to address those issues.
Sure. It's interesting how the upper back and that part of the spine right into the neck, it's an area so many, I think, modern workers who are at a computer or looking down at a tablet or the mobile phone, let's admit we all do it too much, this is a big culprit. Absolutely.
So you have to think about the poor postures that you have. If you're sitting like this all the time, certain muscles in your neck, maybe right here in your upper traps, a lot of people have an upper trap pain, all of those muscles can have tight muscle bands that refer pain up into the head, neck, and face.
And a lot of us are told this as kids, hey, sit upright, don't slouch, right? Pretend like there's a string at the top of your head, you know, you kind of just sitting upright properly, that neck. But if we're looking down all day at I mean, this is bad news. It can be.
It can be. And what we work for and exercise-wise is to improve your postural stability and postural strength. So we're strengthening muscles in the front of your neck. We're doing flexibility exercises so that your neck moves a little bit better. Maybe some exercises that help you to improve your motion in your cervical spine.
It's great to, you know, because people out there who have the pain and they're not quite sure, you know, they tried stretching, maybe some things, they come to GBMC, the Rehabilitation Center there. Your therapy programs help not just realign what needs to be realigned, and chiropractors are known to do that part, but we were talking about this before, you actually help lock in the change, the good change.
Yes, and so threefold treatment for cervicogenic headaches. One is going to work on that soft tissue, those muscles. The one is the mobilization and manipulations of the cervical spine. For us, when we do those mobilization and manipulations, they can help kind of move things a little bit better, but we also need to do exercises to reestablish that normal so things are in a better pattern.
It doesn't slip out again. We want to keep it locked in, right?
There does need to be flexibility and posture. You need to be able to move, but you need to be able to control it and control it in the right way for a sustained time.
I like it. I like it. Any other thoughts out there for people who, you know, look, we live in a modern world. So many of us, we just have to log in those hours at the computer every week. We have to use those mobile devices. Any other tips, thoughts you can give us to kind of help?
So just think about with headaches, about 20% of the population, their headaches are muscular, cervicogenic in nature. So you don't want to live with those headaches if you feel like they are going to be able to manage with PT. There's a lot of good conservative managements that you can use. And we have a talk coming up on the 24th where we can kind of help you distinguish things that may be cervical related versus other types of headaches.
Right, you want to get to the bottom line. I mean, when we think of headaches, there are many different contributors, and so this is obviously one key area. Great to understand that common link coming up on Tuesday, April 24th, gbmc.org for more information. Christina Penny, a wealth of information. Thank you so much for coming here on the show today.
Thank you for having me.
I'm going to be trying to sitting up more right today. I'm going to try to do the right thing, and if I have a problem, I'm going to come see you, okay?
Absolutely.
Thanks for being here, Christina. We'll be back with more Midday Maryland on the other side of this break. Stay right here.